Hello and welcome to EVN Talks. I'm Rubina Markuns. I'm the managing editor, but before I was a reporter. I used to do interviews, and I'm glad to be back doing interviews around interesting subjects with interesting people. And today is one of those conversations. And as it's become customary for EVN Talks, we're talking a lot about fixing and initiatives that Armenia needs. And we're talking a lot about how to identify a need. And today is going to be one of those conversations where a need has been identified and an initiative has been initiated. In that regard, my guests today are Dr. Jeffrey Markuns, Executive Director, Boston University Global Health Collaborative, Founding Director of Health Professionals Education Program at Boston University, Dr. Aram Kaligian, Assistant Professor of Family Medicine, Director of Armenian Medical Partnership Program at the Boston University, and Aram Voskerchyan, co-founder, HENAR Foundation. Welcome, everyone. And I think from the descriptions of who the guests are, everyone can guess where this conversation is going to go, more or less. This is an interesting collaboration between what's happening with the Boston University and the HENAR Foundation, and also the target is the healthcare system in Armenia. Can you guys please briefly explain what the initiative is that's already started but is happening right now, and we're going to be seeing results soon, hopefully?
Sure. So the program that we're involved in now is really trying to support a change in postgraduate training for doctors in how they get trained here in Armenia. So traditionally, there's been more of a knowledge-based program, more focused on lectures and less hands-on experience working with patients directly, as there are in many other parts of the world. And so our goal has been to try and help the current postgraduate programs change to be able to do more hands-on training. And so the way we've done that is really first to try and identify some core champions from each of the institutions at NIH and YSMU who can learn about these new advanced education techniques to try and move the programs to be more hands-on. And as they participate in a master's program that we've developed at Boston University in health professions education, which is the education of all kinds of health professionals. That is, they do that program, they also have a practicum for that program. And in that practicum, they will deliver training of trainers to their own faculty from their own institutions about how they can reform their curricula to be more of a hands-on focus. And they will be doing that alongside faculty from Boston University who are coming in 3 times this year to support them with direct side-by-side delivery of the program. And then over the next several months, they will continue to work with their faculty to reform these curricula and design these new programs that then at the end of the year, they'll have a new curricula that they can teach to their own medical students as they graduate and enter the program in this new style of teaching.
And with everything else, we wonder is how does this work locally? Is Yerevan, Armenia, accepting of this? Are the institutions here, is the educational system here, and the healthcare system here ready to be on board with this? And how do we ensure this program kind of yields results and brings in the change that it is designed to bring?
Well, let me try to address this question. The HENAR Foundation, from the first day it was established back in 2021, it was founded together with Ruben Vardanyan and Nubar Afeyan. From the day one, we had a goal to contribute into the transformation of the healthcare in Armenia by bringing together industry, academia, policymakers, and by initiating the projects which can have a systemic impact and address the key gaps in Armenia. And we started with a pretty comprehensive healthcare system assessment, which revealed the key issues or challenges. If I just summarize it, there are 4 main of them. One is the current funding model in Armenia. Second is non-communicable diseases, the burden of non-communicable diseases, healthy lifestyle, and the level of education in healthcare. So for the level of physicians, nurses, and while we have, in terms of the number of physicians, we have a pretty good number in line with some standards. But if you look at the quality of nurses, doctors, and the distribution of doctors specifically, you will see a big discrepancies. Yeah, a majority of our doctors, for instance, physicians actually are located in Yerevan, and in some markets we have significant shortage of physicians. The same situation with nurses, we have even more issue there. So all this actually forced us to prioritize three key areas for the intervention. First is primary care as a foundation for the healthcare, is actually where the patient meets the physician, and without having efficient primary care system, you never can build sustainable and good healthcare. So second point is everything related to talent development, education for physicians, nurses, and the third is digital transformation to provide access to quality health care. So that's why the talent agenda or workforce development was number one priority in our agenda as of day one. And we were very happy to find such a great partner like Boston University Medical School. Actually, the first contact we had, I think it was back to 2022. And since that time, we have been working very closely with our colleagues from Boston University, leveraging their big experience in Armenia. You will hear probably a bit more from Aram, how they have been involved in Armenia since beginning of 2000, even before. And now we are moving to the next step with few really big initiatives which are addressing the key needs of Armenian healthcare. And this program is a great example how we are really making a difference by engaging more doctors and empowering them to become an ambassador of the change here.
So much is changing or is hopefully will be changing in the health sector in Armenia. Armenia is moving towards primary health care. More polyclinics are being involved or being pushed forward to the front lines. Armenia is talking about universal health. The government's talking about, the ministry is talking about digitizing the whole healthcare system. There have been attempts to what some extent successful, to some extent still experimental within all of this. And also they're talking about implementing family medicine as such in Armenia, which is not necessarily a traditional kind of approach to healthcare. With everything that's changing and everything that's still in an experimental and a transitional stage right now, and we don't know what will come next year because a lot of systems keep being built and keep not working as well as we hope, which is, I think, natural. There should be an experimental or a trial and error phase. With such big initiatives. Where does this really come in, and where does it hit in this system that's constantly changing?
So in terms of deciding how to get, so first of all, I became director of the BU Armenian Medical Partnership in 2022. It was started in 91 by Dr. Chobanyan, who's the dean of BU Medical School at the time. And there's always been some activity going on, but there's always been like medical students or faculty that might go back and forth. But being able to, it's always been a hope to try to become more systemic in terms of having bigger effect, right? Because there's a lot of resources in the diaspora, and there's always been something that a lot of us in the diaspora want to do is how do we take the resources in the diaspora and be able to help Armenia, improve.
And so, we've often been recently, at least in crisis mode, there was the war effort, there was COVID, and all of these resources went to service those needs that were crucial at the time. Now at a more stable times, maybe
we're trying to build up the system, right? So when I got started, the first thing was to try to figure out what does Armenia need, because I have a public health background too. So a lot of times the problems people have in diaspora is like, I'm this kind of a person, let me go to Armenia and let me bring this along, and it's not necessarily what Armenia needs. So when you've got a public health background, it's important to know, to find out what the government needs or what their priorities are and make the alignment. And so that's where working with HENAR was my first contact, was somebody, a foundation on the ground that would be able to coordinate with the Ministry of Health, the Ministry of Education, the medical school, the NIH, clinics, all the key stakeholders to figure out what are the priorities and where can we fit in as BU Armenia Medical Partnership to kind of match those, because we have lots of resources, but I don't have all the resources at my disposal. But I have a great resource in Jeff Markuns, who we've been known each other for 25 years now. We were residents together. And he's done a lot of work in Southeast Asia and in Southern Africa in primary care development, where, the BU was approached way back then in the late 90s, early 2000s to try to develop a primary care system in Vietnam that was very similar to the way it is here. Medical care was very hospital-based, very specialist-oriented. Primary care wasn't invested in. And so I'd been hearing of the work Jeff had been doing and our department had been doing in Vietnam and Cambodia, and so it was an opportunity to see if I could get Jeff involved, and he came along and has been working with us on a couple of projects now.
And the hands-on approach, as you described it, could you describe it a little further? And I don't know if, as society and as potential patients in Armenia, we're ready for also to receive such an approach from our health professionals. How do these aspects factor into this program?
Yeah, I think, this program is the beginning of a long-term effort, right? So I don't think that we change health systems in just months or even a few years, right? The typical investment cycle is often quite short, but the reality is to make big changes in health systems, you need to plan on a 1 decade, 2 decade timeline for change. And so this is the initial seeds to grow and how to develop this new type of system. So in the US, for instance, when we do postgraduate training, nearly all of our training is hands-on patient care under the supervision of another health professional.
I personally would ask them to leave if they walked into any
so
any
that's
clinic that I was being treated at.
Yeah, so that's actually very interesting, because we had a conversation today with someone from one of the training programs, and they said they've been sending their students to Sweden to get 2 months of training there, and they came back and they said, well, what's the difference between the training in Sweden and the training in Armenia? And they said, well, in Sweden, the doctor we work with, when he asks the patients if we can examine them, they say yes. And in Armenia, that's not the case. So there's definitely a cultural change, right, to build trust and confidence with patients that this is a safe way to receive care. And that if the supervisor is skilled and present and available in that process, then we've found that patients become very responsive to it. And in fact, it ends up, if you do teaching at the bedside, it becomes value added time for patients, because they get more time with their doctor. They get to hear what their doctor's thinking about in their case and what to deal with as they're teaching that learner. And so we've found a variety of patients really appreciate having that kind of experience if it's done well. And so that's one of the goals here, is trying to help people learn how to deliver that kind of medical teaching.
Is it also a little bit about, sorry for this, bedside manners when it comes to hands-on training? Because my experience has been that there are trainees in the hospital alongside patients, but that relationship doesn't always work out. So
yeah,
are we also talking about this? Because when you mentioned more hands-on training, it was a little surprising for me, is that does that not exist in Armenia, and what kind of an education system do we have if we don't have it? For someone not from the sphere of healthcare, I thought that was an integral part of the practicum, was an integral part of any education system. So how much of that were we really lacking?
A lot. That is not an integral part of the postgraduate training system here in Armenia. And that's been the conversations that we've had with the training programs about this, and with the Ministry of Education, with the Ministry of Health, and why I think they've been supportive of this effort, because they recognize that there's an important need to change and to involve more of that kind of practical teaching into the postgraduate training program. Many family doctors will leave with very little. It might be just the Swedish experience that they walk away with to be able to deliver care. And so it's important for us to design new programs, new ways of outlining the goals of what the learners need, communication goals, professionalism goals, in addition to basic clinical skills goals like taking history and physical and diagnosing disease and choosing management plans. But all of those things need to be done in some kind of a practical format. And then we need ways to measure those things to see whether they're effective and to make sure that they're safe for patients. And so we also have to design new ways for Armenia to be able to measure these things and to know whether the trainee is doing the things that we expect they're supposed to be able to do.
And those things are expected in the future, or they're already in the works, and how's the supervision going to go, and how's the evaluation of the project going to be?
That's exactly what this program is about, right? Is to try and develop these champions who have exceptional skills in this area, and then to work with a substantial portion of faculty. So with 180 faculty participating in this program, that's a little less than about a quarter of the total faculty for Armenia. So hopefully that initial group will learn some of these new basic skills, how to write goals and objectives that are more based on what students do instead of what students know, and then develop evaluation methods to know whether those students are doing what we expect them to do. Once you have those evaluation methods, then you design the teaching to be able to meet those evaluation methods. So it's a little bit different than the way you might think, and that you start with the goal and then you design what you're going to teach and then you measure it. And we start from decide the goal, figure out how you're going to measure it, then you decide what the right teaching is to be able to get that outcome.
And maybe let's talk about participants, because it's a very peculiar program and such, because it is a master's degree. They do walk away with a master's degree, and yet it's a break from their, for these doctors, from their careers or the paths they were, and also a difficult position because they're expected to bring change, which is not something a lot of people might be enthusiastic about. So maybe about the recruitment program, of how the applications were, if there were sufficient applications, were they too many, too little, or you had to actually go out and seek people to, or handpick people to offer to participate?
Sure, it's a great question, because finally the success of any project or initiative in Armenia depends on how effectively you can adapt it to the local context and local realities, yeah? And we clearly realized that actually the copy-paste approach will not work here. That's why when we worked on the design of the program, it was done together with our local partners, with the State Medical University, Yerevan State Medical University, with the National Institute of Health. Both ministries, the Ministry of Health and Ministry of Education, has been involved, not only informed, but actually involved and consulted. And finally, we come up with the approach when the students, let me call them students, while they are actually practicing physicians, but students for this program or candidates have been suggested by the academic institutions. So we got a list of people from them, and then based on some pretty strict selection criteria, we come up with the list of 6 chosen final candidates. Why it was important to make sure whoever will be involved into the program will be supported and in fact empowered by their academic institutions to become this ambassador for change. Yeah? Otherwise, it would not work. The program, the success of this program depends on how the students will be able to translate, to actually give this knowledge to wider audience of physicians. Yeah, and it only can happen if they get proper support from their academic institutions. So that's why this program is a very good example of the partnership when different participants, actually participating players, are bringing their strengths into the program, and actually collectively we are coming to the point when this change can become a reality. So it's a kind of good public-private model of cooperation. And that's kind of, I think, the real success, big success driver of this program, and in fact, any other initiative in Armenia, specifically in healthcare domain.
The projects are expected to be self-sufficient at this point, but in this particular case, these participants were nominated by their organizations or institutions to be the torchbearers of change, and they agreed. And this is a program that supports them for a year, at least that I know of. And then for the later stages of implementation, is there a support system for them coming from your initiative that makes sure that what they were trained in and what they started is continuous? Or is there a point where there's a cutoff point and the government is supposed to take over, or the institution is supposed to take over, or the initiative becomes self-sufficient in any way, or just stops, which has been the case with a lot of similar initiatives? What's the long-term plan there, or is there one?
In our work at the Chobanian Avedisian School of Medicine, one of the things generally at our Global Health Collaborative, when we engage with a country, as I talked about earlier, we plan to engage on a long-term basis. So we don't typically take on a project on a short-term basis. We're going to try and work with the partners there for that decade or longer that it takes to be able to make that change. I think, based on the government's priorities, the primary care is clearly a key focus of what needs to happen going forward. So for our staff in particular, we'll be particularly engaged in trying to support change and development of new programs in primary care. Already, HENAR has been involved in a pediatric residency program pilot here, and we're looking to try and bring that forward to family medicine as well, as you mentioned earlier. We'll be here to help support the other programs, but there will need to be government engagement, other partnership to support all of the postgraduate programs to be able to make these transitions into new ways of teaching. And so, we're sort of setting the table for opportunity. We'll still be here for support, but, our goal is never to implement on our own. Our goal is always to raise up the workforce, build the capacity in country, and then support them to be able to build their own infrastructure to be able to carry these things forward.
Dr. Kaligian, you had something to add?
Yeah, I was just going to say, the institutions gave nominated people, and then there was an application process, that they had to meet. They had to speak English because the instruction was in English, and we wanted people who were, senior enough in their careers that they would be able to implement change, but not so senior that they wouldn't. You want people
they wouldn't
young
change
enough.
themselves.
Yeah, you want people young enough who are interested in making change, but but you want them to have enough, seniority that they can actually make the change. And pretty much everybody in our that came in have all had experience, seeing this model outside. They've all either had a couple of months or even longer working in residency programs in Europe, or one was in Britain, a couple were in Austria. So I think that's what made them realize that this is something they all want to make these changes in Armenia. It's because they've seen it in action. And so, the lectures are online, there are classes online, but, we're having 3 workshops, week-long workshops. This is the first one is now. And then there'll be one in the winter and then one in the spring, where we're coming from BU to kick off, like this, we're kicking off the Trainer of Trainer workshop. I
think it's really aligned with the ministry's vision as well. So meeting with the minister, she, Minister of Health, she talked about the new guidelines that they've put in place for what's going to be required for postgraduate training. And so also I think the good news is the government is already stepping forward to take on responsibility for carrying these things forward. So hopefully we prime the pump in a aligned way with the government, and then the government is able to carry that forward through their own policies. And as I mentioned, we'll continue to be here and support in what ways we can.
And that's where it's been important that HENAR is involved, is because he's continuing to have these meetings with the ministry, with all the partners here. Yeah, and it's very difficult otherwise to do this. I was involved in a family medicine retraining program that the USAID ran in the mid 2000s, and it could only go so far because there wasn't that kind of there just isn't. You need to have
The
people on the
infrastructure
ground
also,
that really,
in a way.
yeah. There's all sorts of people in Armenia doctors who want to have BU help them with whether they're pediatricians or neurologists or all these different or oncologists. It's just you have to pick where you're going to work with and what our resources are that we can work with, and we're targeting where we can have the most impact, most systemic.
And sometimes timing is key to everything. Change can be premature, can be overdue, but it can be also right at a time where it can take root and actually make an impact. Thank you everyone for joining us today. I think we ran out of time, unfortunately. Healthcare will be something, and similar initiatives, change in general, something that we talk a lot about during our podcast. So I hope to see you back here sometime soon, and we'll continue the conversation.
Thanks for having us. Thank you.
Thank you very much.